we present Borderline by Nigel Banks.
Get some help in here. Need Dr. Solway immediately.
Get a line in now. We'll have to intubate him. We've got 3s available. Left femur and a CAT scan, please. Stabilise at 150/82. Standing by. Let's get him up there. Full blood count, O's and E's, and an angiogram now. Charging 360. Clear. Shocking. Clear.
Can you hear me, Keith?
Where am I?
You're in the hospital. You had a bit of an accident, but it's okay. We're going to look after you. Is there anyone you'd like us to call for you?
Jean. Get Jean.
Is that your wife?
Yeah.
Okay, my love. You just lie still and relax. I'll make sure we contact her.
What happened to me?
It looks like you had a problem with your heart while you were driving, but try not to worry. We'll look after you.
How's the patient?
He's come round, but still rather groggy and a bit disorientated, Doctor.
I was expecting some specific stats, not a vague subjective opinion, Nurse Mossop.
Sorry, Doctor. His BP's 153/85. Pulse rate's 88 and stats are normal.
He seems stable at present, but someone of his age who's clearly overweight and doesn't lead a healthy lifestyle could well be in danger of suffering another cardiac event, so you'd better keep a close eye on him. We didn't have enough on our plate, and NHS resources stretched to breaking point without having to deal with the likes of him.
That's rather judgmental, Doctor, if you don't mind my saying.
Hardly. The evidence is plain to see.
But we don't know all the details. His weight problem could be caused by a glandular condition rather than his lifestyle, and his cardiac problem could be congenital. Even the fittest of young men can be struck down. What about that footballer? What was his name? Fabrice something or other? Collapsed in the middle of a match. You couldn't accuse him of having lived an unhealthy lifestyle.
That was a very rare occurrence. A statistical anomaly. This patient shows all the classic signs of self-abuse. Look at his face. The colour and texture of the skin. He's clearly a smoker, which immediately raises the risk of cardiac and pulmonary disease in later life. Do we know what job he does?
He's a driving instructor, I believe.
There you are then. Sedentary job. Doesn't take enough exercise. He's the classic case of a myocardial infarction waiting to happen.
And now that it has happened, surely it's our duty to give him the best possible care and attention.
Of course. We must be seen to be upholding those outdated NHS precepts.
So young, yet already so cynical.
I prefer to think of myself as a realist. I don't see the point in propping up a failing system with increasing amounts of taxpayers' money. It's about time we faced up to the inevitable and introduced a workable system. Then people like Malado here would have to accept the consequences of their unhealthy lifestyle and pay the market price for medical care.
Ah, I see. So you're what? Gaining valuable clinical experience in the state-funded healthcare sector before setting up in private practice?
Got it in one, nurse. If I'm not a consultant before I'm 38, then I'll have grossly underachieved. Cosmetic surgery. That's the way to go. Serious money to be made there. Of course, you have to go to the States to get the really big action. Much bigger market over there.
Yes, so I believe. Lots of Pamela Anderson wannabes to get your hands on.
Pamela who?
Sorry, yes. Showing my age, aren't I? Think Katie Price and you'll get my drift.
Oh, right. Anyway, can't stand here chatting all night. 30-minute obs on this one. Page me if there's any deterioration. Let's have a quick look at the RTA case opposite, then I'll be on my way. So how are we doing here, nurse?
No change. She's still in a coma. Severe head trauma, so it's not looking good. Neuro have been down to examine her, but they're so backed up in theatre with priority cases that there wasn't a slot available today. In any case, the prognosis is so negative, it's doubtful that surgery would do any good.
Have next of kin been informed?
Still trying to contact the mother, but no joy as yet.
Okay. Keep me posted. There's a lot of pressure on bed space, so let's hope nature takes its course sooner rather than later.
Tell me, Dr. Solway, just out of interest, if you had the legal right, Would you administer a lethal injection? Put her out of her misery?
I'm not sure we should really be having this conversation, nurse. It's not appropriate under the circumstances.
Why not? She can't hear us. She's been heavily sedated. Given your earlier enthusiasm for cutting costs and saving waste, I should have thought legalised euthanasia would be right up your street.
That is a highly complex ethical and philosophical debate, which I refuse to be drawn into whilst on duty, and certainly not one I propose to have with an agency nurse. Now, if you don't mind, I have other patients to see, and I'm sure you have plenty of other duties to attend to.
Of course, Dr. Solway. I'll make sure I put my overstretched NHS arms to good use.
Do you know what? I don't like your tone. I've a good mind to report you to your agency and recommend that they strike you off their list.
Do you know what, Doctor? I've been nursing patients since you were in short pants. I've seen hotshot junior doctors come and go. So you go ahead and report me. I don't give a shit.
Fine. Just make sure you do the obs.
Don't you worry, Dr. Smartass Solway. I'll do the obs all right. Now then, Molly. Let's make sure you're as comfortable as we can get you. You poor thing. Bet you didn't expect you'd end up here when you set out this morning. Right, I'll just see how Keith's getting on over there, then it's back to the jolly old paperwork for a while. I'll check up on you again soon, Molly. OK, Keith. How are we doing? Stats look stable enough. Are you still awake, Keith? Can I get you anything, pet?
Water. My throat's so dry.
There you go, my love. Is that better?
Yeah, thanks. Where's Jean? Has she been yet?
No, love. We haven't been able to make contact with her. We've tried your home number several times and the police have been round, but there's no one there apparently. Has she got a mobile?
Yeah, but she never uses it. I keep telling her, but she just says she can't be bothered with it, so it gets left in a drawer. What time is it?
6:10.
She should be back by now. What can have happened to her?
Oh, now don't go getting yourself all wound up, love. That's the last thing we need in your condition. I'm sure there's a perfectly reasonable explanation. I'll go and see if there's any more news.
Thanks. Where are you, Jean, when I need you? I'm so tired. So tired. Where am I? A white room. Is this it then? What is that? It keeps playing around inside my head and I can't get rid of it. I don't recognise it, but it sounds so familiar. Oh, this is going to drive me nuts. I'll name that tune in. Ah! Is this how it ends? The White Room? Where you end up before you shuffle off your mortal coil? No! No!